Cromolyn is a medication used to help manage asthma and allergies long-term. In this mnemonic video, we'll cover important facts about Cromolyn so you'll be ready come test day. I'm feeling under the weather, and like most people do when they're sick, I'm turning to the internet to look up my symptoms. Take a closer look at my Chromebook here. Use this Chromebook along with the Chrome internet browser to help you remember that we're talking about the drug Cromolyn. Chrome for Cromolyn, okay? I was worried these symptoms could be an asthma attack, so I have my asthma inhaler here nearby just in case. Here at Pixorize, we use an inhaler to symbolize treating asthma, because people with asthma often carry around an inhaler, right? Let's move on to talk in a little more detail about how Cromolyn treats asthma. Ugh! The Chromebook's internet is loading really slowly. This loading sign with the hourglass has been on the screen for a long time now. The way that this Chromebook loads slowly reminds me of how Cromolyn is a slow-acting medication. In other words, it is used for the long-term management of asthma. Because it is slow-acting, Cromolyn is not used as a rescue medication for acute asthma attacks. Instead, it is taken as scheduled throughout the day to prevent asthma attacks from happening. Make sense? So, what exactly are my symptoms? Well, I have watery eyes, I'm sneezing, and it all started when I opened the window on this nice spring day. I'm no doctor, but I bet this has to do with allergies, don't you think? Cromolyn can also be used to treat seasonal allergies, also called allergic rhinitis. Just remember my allergies here to remember that Cromolyn treats allergies. Since my Chromebook was taking so long to load, I enlisted my roommate to help me look up my symptoms. As you can see, she also has a Chromebook, but her Chromebook slipped off the table and the cable somehow got wrapped around her neck, causing her to choke and gasp for air. This is here to symbolize rebound bronchospasm, so let me explain. Cromolyn should not be suddenly stopped or dropped because doing so may cause bronchospasm. Just like how the sudden dropping of this Chromebook has caused difficulty with breathing, an important nursing consideration is to teach your patients not to suddenly stop taking Cromolyn. Instead, this drug should be tapered off slowly over time. Alright, that's all for this video. Let's recap. Cromolyn is a medication used to treat asthma. It is a slow-acting drug, meaning that it does not work as a rescue medication, but is instead used for long-term maintenance therapy of asthma. It can also be used to treat seasonal allergies or allergic rhinitis. If Cromolyn is suddenly stopped, it might result in rebound bronchospasm. To avoid this, the medication should be tapered off slowly. And now, we're actually done with Cromolyn. See you next time.
Thanks for watching. For more videos like this one, subscribe to our channel and check out our newest lessons. For more resources on this topic, including fact lists and interactive review images, click the image next to the More Here arrow. I'll see you next time.